Good morning, everyone. Good afternoon, everyone. Welcome to Team TDF Wellbeing webinar. My name is Irena Petrovska, and I am an acupuncturist. And we are going to do today acupressure for aligning with spring that has come to us to make us feel better and release the bad energy. We are sorry about the delay. There were some issues with computers, so I'm replacing my colleague today. Remember, all of your videos and microphones are switched off. No one, including me, can see or hear you. TDF is a charity that relies on donations, so please, uh, what you can. Please give what you can. Now, make yourselves comfortable and minimize distractions, like turning your phone to silent mode. Do close your eyes if you feel like doing so. Please remember to participate according to your own abilities. You can stop and start at any point during the webinar. You are in charge. The session will end by 12:30. If you have any questions after the session or want to get in touch, email us at therapysupport@tdf.org.uk. Remember, acupressure is a complementary treatment. If you have any doubts, please talk to your doctor. Now, we are about to start. First, I'm going just to briefly tell you what kind of acupressure techniques you can use. So the first technique that you can use is as simple as just pressing the point. Whichever point I'm going to show you where to press. Now it's not the point that we are going to press, I'm just showing the technique. So just press constantly. The other technique you can do is press and lift, press and lift, press and lift. The other technique is doing this circular motion over the point in one direction, in other direction. Please try to find out what feels best for you. The other way to press, let's assume this is the point, is to do this linear motion, head to toe, fingers to wrist, linear motions. And the other two techniques that I am going to concentrate on, but please remember to use them only if you feel comfortable with them. They are just regular techniques. It's just that they require additional concentration. So the first technique is nipping. For that, you are striking the point with the nail. It is invasive technique. You start with using little pressure, and then gradually you use more force. At the end of nipping the point, given point, you just rub the area to soothe it. And the other technique that we are going to use is pounding technique. So what you can do is using the tip of your middle finger, you just strike the side. Make the wrist the center of movement here. The other way to do this is using the knuckles of index or middle finger. You just do this. Yeah, you can switch fingers in when you are tired. You can just switch fingers. You can use more fingers if you are not sure about the location of the point. Then you will cover the bigger area, so there's more chance that you will stimulate the point that we want to stimulate. And then in regards to children, you can do acupressure to children. I do that every day on my daughter. And the way to do on the children, the pressure you may want to use is just as if you were checking if the cake is baked, or I just spoiled my cake. Just very delicate motion, or if you were finger painting, it's the same type of pressure. They can take more pressure, but start with as little as just simple touch, or just showing affection. So let's start now. I'm not going to be comfortable, but I want to show you the points. This is my job here. So I ask you to make yourself as comfortable as you can, and we'll proceed. So the first point is located on the foot. So to find it, it is located between first and second metatarsal bone. So you just slide from between the toes. You just slide with your finger until you can't go any farther. And this is the point. This is lever 3. Let me turn on the timer and we'll start. Timer on. So now we have the point. We can constantly press or press and lift, press and lift. You can change fingers, or you may do this linear motion between the bones. Or the other way to do this is to use the technique nipping, the nipping technique. So you use your nail and you just nip the point. So what we want to do is to do this technique rhythmically. That's why I am going to turn on the metronome, and we are going to nip 120 times strikes per minute here. You can change sides. Please continue doing so. I just want to tell you that you can use any. Now we are going to switch the side. Let me explain again how to find the point. So it's between first and second metatarsal bone. You slide fingers starting from between the toes, and you just slide there until you can't go any farther. And again, you can use any technique you want. If you choose nipping, this is how it's done. You increase the pressure, or you may want to by increasing pressure, you are getting deeper and deeper into tissues. Please continue doing so. I just want to explain what this point is doing. So this is the perfect point for releasing stress, releasing anger, releasing bad emotions that accumulated. And you sometimes can feel it like there's something stuck in you. So the bad energy. And this will help you. This will help you relax. This point is helpful with pain as well. So if there's any pain in the body, this point will help by just relaxing our bodies. I'll stop the metronome because I want to tell you that the reason why I'm turning this on is because I want us to get into habit of doing acupressure rhythmically. You can do this to any piece of music that you like. Make it fun, make it nice for you, make it time for relax, and just try to enjoy it as much as possible. So now we are moving to the next point. It's located on the level of medial malleolus. So this is medial malleolus, this is the level, and this point is located between the Achilles tendon and the medial malleolus in the middle. It's kidney 3. So the technique we can use can be pressing and lifting, pressing and lifting, or circular motions, one direction, the other direction, or linear motions, head to toe, up and down in this position, and or the nipping technique. So let's start again. Using the nail. You can change fingers. Now we are going to switch other leg. And again, we find medial malleolus, and then there's Achilles tendon, the posterior side of it, and the point is between them, yeah, on the level of medial malleolus. Here is kidney 3. Please continue doing so. Again, I'd like to talk a bit more. I'm still pressing the point, kidney 3, on the leg. I just want to explain what we are doing, what is our aim. So basically, spring is a time when life bursts, and this season is, you can kind of think of spring as the source of creativity, or the time of creativity. So what we are trying to achieve here, please continue on pressing, is to refresh our body, to relax our body, to just let this new energy, new ideas flow in us, to release pain, and to strengthen our body. This point strengthens our body. All of them do, and all of them work uh, towards releasing stress in different ways, and this is what we want now. We want to align with spring and its spirit. So the next point that we are going to press is located here on the thenar, and it's located on the, there's this border between red and white skin. So it's located on the border, and the other important uh, thing to remember when you try to find this point, it's located in the middle of the first metacarpal bone. So here are the heads of the bone. So it's, this is the level, and we go here. So the technique that we are going to use here is pounding. Try to make it here. So it's pounding, yeah? And we'll do this rhythmically as well. Now we change sides. So again, middle of first metacarpal bone. Here, yeah, the heads are under my third middle finger and thumb. So this is the middle of the bone. We move towards the thenar, and we try to locate the border between the red and white skin, but it's basically in the middle of here. And again, we can use pounding technique. Please continue doing so. So this precise point helps when we have sore throat, helps when we have cough. It clears this point that is located bilaterally. It clears the lung. It helps with agitation, with anxiety, and it helps with rebellious chi. Rebellious chi is, please continue on pressing. Rebellious chi is when the movement here is in the wrong direction. So it anything goes up instead of going down. So it's cough, it's nausea, it's vomiting, it's acid reflux, anything that goes in the wrong direction. This point will help it. So we've just done the spring protocol. It helps us balance after the winter and adjust to new season, and just help us align with what spring can bring us. I hope you feel more relaxed. I hope you feel calmer. I hope it helped you. And in case any of the points were sensitive, it it's okay. It may even be a bit painful, but it's fine. I mean, by pressing the point, by using acupressure technique, we can release the stagnation there. We can help the pain just disappear. So if you press the same point each day, you may notice that your body reacts differently on the given day to the point that you are actually pressing. So it is normal. There we are changing. There's always movement within our bodies, and this is what we want to help with. This is movement. It's called sometimes it's called life. But when everything moves smoothly, we are happy, we are healthy, we don't experience pain, and we are stronger and can just go about our days with our full potential. So the last point that we are going to press today is stomach 36, and this is to boost our immune function. This point is located below the knee. Here is the patella, and this below the kneecap, the patella, there are two depressions. Try to find them. This is patella, depressions are two below. Place your hand on the level of those depressions because the point we are looking for is located hand width below the depression. Now locate the tibia bone, the anterior crest of tibia, and slide the finger from the tibia. And this is next to this finger. This is the point. So you can mark this point. I usually mark with my nail. Now I can't see it because if I mark it this way, but you can use sticker, whatever you have in hand, you can just use, because we can press these points simultaneously. So again, patella, the depressions below the patella, you are placing your hand like this, and you are trying next to this is anterior crest of tibia, one finger width away, and here we are. So we can press these points right now simultaneously. With pressing point, especially with this point, we want to know to boost our immunity. We want to know that we have stimulated the point. So when they are stimulated, we can feel warmth and a bit of soreness at the area of the point. This is what we want. That's how we know that we've done a good job and our immune system will react to this stimulation. So it's okay to feel a bit pain. Be careful and don't break the skin, because you can use the nipping technique here as well. This is much more efficient. Usually it takes 5 to 10 minutes by just pressing the point or doing the circular motion, linear motion, or just pressing, lifting. With nipping technique, the effect can come within seconds. Just try to strike the point with your nails and do this rhythmically if you can. Remember, make it fun. Make it positive experience. Just press. Just stimulate. Yeah. So this will help us have the benefits of acupressure. In this particular with this particular point, this is important because we want to stimulate our immune system. The other thing is that it is absolutely fine to make acupressure through clothes. You don't have to have bare skin. You can do acupressure through clothes. It's fine. So as you can see, it's doable when you are in a public place, or when you are commuting, you can do acupressure, or when you are sitting at your desk at work. So I hope you enjoyed today's session. This is all for today. Thank you to everyone who participated today, and please attend again. Please else tell your family and friends if possible, and if you like the session, please support the charity's work. I wish you to have a great Wednesday and wonderful end of the week and weekend. And I hope that you are relaxed and will enjoy spring more. See you next time.